Hi, my name is Kati Hinkle and I'm a nurse practitioner at Potosi Rural Health Clinic, and recently I visited New York City to work on the front lines with the COVID-19 pandemic. A little bit about me: I've been a nurse practitioner for 7 years. About 6 of those years I worked in orthopedics, and the last year I worked in primary care and urgent care. I decided to go to New York to work and it was surreal. The plane ride in, there were 6 of us on the plane, and most of them were actual airline staff members, not healthcare providers or people traveling for business or pleasure. I arrived in New York on April 1st. New York was beautiful and overwhelming at the same time. The airport was empty, there were no taxis waiting to take people where they needed to go, and everyone was wearing masks. Once I was able to get a ride to my hotel, I signed in with my agency and was told I would receive my assignment once it was made by the state of New York. I was told this assignment could take 1 day to 1 week to get. I volunteered to go wherever I was needed. I had no preference. On Saturday, April 4th at 5:26 a.m., I received my assignment. I rushed downstairs with my slip of paper with the name North Central Bronx. I found a few others with the same assignment, and we waited together for our bus. Once we were at the hospital, the staff asked us what our comfort zones were. They needed someone with critical care experience, and I was the only one who had worked as an RN in the ER, but it was years ago, so I volunteered. NCB has roughly 1,000 beds. That typically includes maternity, neonatal ICU, and psychiatry services. But because of COVID-19, all beds were being utilized for COVID-19 patients. The majority of our patients were on ventilators or were eventually going to need ventilators. After my 14 days working in the ICU, I decided to quarantine. I quarantined in Houston, Texas with a friend that I actually worked with. We were able to secure an apartment down there. We each had our own, and we would meet for dinner, which was okay since we had worked on the same unit together. While we were in quarantine, we did have to sign a piece of paper stating that we would not go out into public unless it was for food or pharmacy or for healthcare. So during my quarantine, I did not have any symptoms, nor did my friend have any symptoms. So at the end of the 14 days, I was able to fly back to St. Louis and reunite with my family. It had been a month since I saw them last, and we were all very excited. I got to spend about a week with my kids and my husband before coming back to work, again, still symptom-free, and excited to get back into my daily routine. The experience was something I'll never forget, and I was very appreciative to get to do, but I am happy to be back with my family, be back with my work family, and take care of my patients here in Potosi, Missouri.